So I think Manur and I don't know the other names. So we can quickly go through the serology. I know it was a last minute thing.
Good
Um,
afternoon, Dr. Sana. Thank you for your time.
Good afternoon, dear. So I was just posting it, about to post it on the main group. So like a few students, they messaged me that they would like it if it's an interactive one rather than just reading it. So I thought that maybe I can set up a meeting and see if anyone can join. So thank you for joining. So I'll just start the slideshow, and it will just take 15 minutes. It's not something that will take a lot of time. So can you see the screen? Let me share my screen with you.
No, not now.
Can you see now?
Um, yes,
Okay, great.
thank you.
So you're welcome. So I'll just quickly go over the hepatitis B serology so that if it comes in the exam, you should know that how to counsel the patient on it. So in hepatitis B, if you get a result, let's suppose that in the result you get hepatitis B S antigen, anti-HBs, anti-HBC. Then we have to HBC has two components. It has IgM and IgG, and then we can get hepatitis B antigen or anti-HB antigen. Okay, so like that is antibody to E antigen. So what do all these things mean? So hepatitis B S antigen means that due to any acute or chronic infection, that surface antigen is present on top of the hepatitis on top of the cells. So that surface antigen is there. So that means that an active, infection is going on at that time. So that is your surface antigen. Now, if you get hepatitis B as antibody positive in the report, that means that that person has recovered or has been vaccinated. So, due to any of the two reasons, that person is having some antibodies. So that's for that reason they are immune. That means that their immunity is either due to their past infection or vaccination. The third thing is anti-HBC. So the core antigen means it has two components, IgG or IgM. IgG means that there was a past infection. So I remember it like this, that G means gone. So the disease is gone. It was there in the past. It's not there anymore. But the patient has developed antibody, IgG against that. So that's why they have it. And IgM means that a current infection is going on. So, like naturally, the infection was there due to some reason and they developed that. So, if the patient has IgM component, that means that it's a recent infection going on. But if it is IgG, that means it was a past infection, probably happened in the past and it's gone now, but the patient has developed antibody against it. When it's hepatitis B E antigen, when E is there, it means that right now the patient is in active, like the virus is in active viral replication stage and it's high infectivity. So if a patient comes to you and who has hepatitis B E antigen positive, okay, then that means that at this time they're highly infective. They can highly infect the other person. Now, why this information is important? Because if you get, for example, a needle stick injury, or if you get labs of a patient that showed this serology and they ask you that give your management plan, that does the patient does the person who was exposed after needle stick injury, do they need any vaccination or not? So on the basis of this you can decide. Now, moving forward, let's interpret everything. So let's suppose if the patient has hepatitis B S antigen negative, that means the surface antigen is not there, but the antibodies are present to that surface antigen. So, what does that mean?
So it means that a previous infection has happened or that guy has already been vaccinated.
Yes. So, if that is positive, then in that case, the patient and the titers are okay, so the patient does not need vaccination again. Okay. So, if hepatitis B S antigen is negative, okay, and your anti-HBs is positive, okay, and your anti-HBC is also positive. Anti-HBC means that it can either be your IgG or IgM. So if that is also positive, that means that the patient uh, has been immune due to their natural infection. Now let's suppose you have surface antigen positive. Okay, that means on the surface, the antigen that was sitting there is positive, but there are no antibodies developed yet. And your anti-HBC is also positive. So what does this mean?
Active infection is going on because antibodies are not there, and it could be active or chronic HIV liver infection, basically.
Yes, so to differentiate between active and chronic, we will see IgG and IgM in the core antigen. If IgG is positive, that means it was an infection that happened in the past, and if IgM is there, then it's a recent infection. Now, let's suppose your surface antigen is also negative, your antibody is also negative for the surface antigen, and your anti-HPC core antigen is also negative. Then what does that mean?
It's mean that I think there is no immunity developed and there is no previous infection.
Yes, so that means that the patient has never been exposed to anything that they could develop the surface antigen or they could develop the antibodies or any signs of past infection. So in this case, you will be going on for vaccination of that patient. Okay. Now, similarly, if you have surface antigen negative and your antibody to that is also negative, but your core antibodies, antigens are positive. So what does that mean?
A previous infection, but
Yes,
it has resolved.
it has
Uh,
resolved. Exactly. So this is a very brief overview of like if this comes in the lab. So Afira, I think you joined later. We did one slide earlier than this. So S antigen means that the antigen is sitting on the surface. Now, when the infection happens, the body develops antibody to that antigen. So whenever you see S antigen present, that means it's an acute or chronic infection going on right now. And when antibody is also there, that means the patient has either recovered or they have developed antibodies in response to vaccinations. So if their titers are okay, you won't be giving them vaccine again in this case. But if you have hepatitis B core antigen, so it has two components, IgG and IgM. G means that the disease is gone, and IgM means that it's a recent infection. So that means that the patient also now has natural immunity against this. But the hepatitis B E antigen, if that is positive, it means that the patient is highly infective at this time. And whoever comes in contact, they can develop the infection. So this is important in case of needle stick injuries. If you get a report in the exam that they show you a chart that hepatitis B, for example, S antigen is positive and antibody is positive. So what will you do next? So you will check the titers, and that means that patient has been vaccinated. So that was just a brief review of this.
Dr.
So,
Sana, sorry, can I ask here one question when you talk about titers? So the hepatitis B S antibodies. So when we check, for example, it is because they see the titers. Or for example, they are less than 10 units something. So
mhm,
do in that case, because I know that if it is more than 10, we will not give any vaccine or immunoglobulin. But if it is
mhm.
less than 10, will we give immunoglobulin or vaccine?
Yes, in that case, then we will give.
Okay. Both of them, or like for example, in case of needle stick injury, there is a titers are less than 10. So we will give immunoglobulin or vaccine with it.
So, in case of needle stick injury, we will check the titers. If the titers are low, then we give immunoglobulins because we have to give them prepared anti.
Yeah, immediate. Okay,
Yeah,
right.
for that. But if there is a patient who has not been, exposed or anything, and there's no emergency, then we give the vaccine. And of course, there are no contraindications.
Okay. And I no, I'm asking that for the needle stick, will we give immunoglobulin and a vaccine or just immunoglobulin?
I think we give both.
Both.
We give
Okay.
immunoglobulin as well, and we give vaccine as well.
Right. Thank you so much for being
Yeah.
so. I mean, for being so supportive and going, extra mile for us. So I really appreciate that.
No, thank you so
We
much,
see
dear.
very less these kind of, gestures. So I really want to take a moment to say thank you.
Thank you so much. That means a lot. That means a lot. So I'll just let you guys go because exam is just in 2 days. So, um, feel free to reach out for anything and all the best. Okay.
Dr. Sana, I have one question for
Yeah.
this lab interpretation. We have this Hep B and Hep C serology, which can come to interpret. Besides that, we have this blood report, and previously you just mentioned in the group that they will give us the high triglycerides and that are concerning for pancreatitis.
Yeah, so if you see a lipid profile of a patient, okay, and you have to counsel them. For example, there's a lipid profile and you have to counsel them. So if in that lipid profile you see that only triglycerides are high, okay, but the rest everything is okay, but only the triglycerides are high, then in that case, like high triglycerides are a bigger risk factor for pancreatitis rather than atherosclerosis. So when you're counseling the patient, keep that in mind. That's what I wanted to say. But all, if everything is high, for example, cholesterol is high and LDL is high, HDL is low, then in that case, of course, it's more towards, atherosclerosis and metabolic diseases, etc.
Fatty liver disease.
Yeah. So in fatty liver disease, they can give you fatty liver disease and like non-alcoholic fatty liver disease and alcoholic liver disease as well. I've done some free classes on that as well. They are on the YouTube channel. So you have to know the ratio of AST to LD and see that if it is fatty liver disease, then your history and counseling will be around that. So you will ask about the weight gain, polycystic ovaries, all those things. But if it is around, cirrhotic changes, ALT or alcoholic liver disease pattern of AST, ALT, then your history will revolve around that. So just look when you look at the lab interpretation. So, look thoroughly that what they are asking for.
Okay. All right. Thank you so much, Dr. Sana.
You're welcome, dear. Take care. So I'll stop the recording now, and you guys can just go and study for the exam. Take care. Bye.